All right. Hi, everyone. And I want to welcome Dr. Kumkum Patel to our summit. And we are so excited to have her here. She is a board certified GI specialist, and she is going to talk to us today about the other PPP, which is pooping in pregnancy and postpartum. So welcome, Dr. Patel. Thank you for being here.
Thank you so much for having me. And I love that acronym, PPP. I'm going to have to use that.
Yeah, I just thought of it. I was like, I think this is relevant, especially since we're in this COVID era now, a whole new era of medicine and healthcare. And
Yes.
before we start talking about my favorite subject, poop, tell me.
Yours and mine.
Yeah, and yours, exactly, since you're a GI specialist. So tell me how you got into this field of medicine and sort of what brought you here.
So, in undergrad, I did bioengineering, and, I loved seeing how technology really made an impact in medicine. And as I went through it and got through medical school, I realized, I really wanted to use my hands. I wanted to help women, and I had a lot of GI issues myself. IBS, no one talks about it, how stress impacts it, med school stress impacts it. And, as I got older and I talked to other women, I realized this is where I had a passion and I had a strength. So together I felt like it was my calling. I got to do procedures, I got to help people, and I get to talk about poop all the time. And so, it's a great field. And I think there's so much variety that, go from mouth to butt, all the way and everything in between. And there's so much variety that you really will never get bored. So that's how I got into it.
Well, thanks for sharing. And I think it's especially relevant now because you mentioned IBS, and during COVID, there's a lot more stressors. And we both know as physicians that IBS is definitely made worse by stressors. And
Absolutely.
addition to that, there's a lot of women who are obviously pregnant because pregnancy doesn't stop for a pandemic. And they might need resources like this to sort of evaluate some of their symptoms because they may not be able to get in to see their doctor. And of course, we're not telling people to skip their appointments or anything like that. There's obviously telehealth tools to see your GI specialist, but just some guidance during this time when there's limited resources to be going in to see a doctor.
Absolutely. And just like you, I'm also a COVID mama. So, having given birth during this time, having experienced the stress of not just being, in dealing with COVID, but just being a mother in this new COVID era is a lot. And a lot of people have experienced a flare of their symptoms, and whether they realize it or not, it's not just dietary. A lot of it has to do with stress, anxiety, depression, and being postpartum adds a whole new level to that. You add anxiety, stress, hormones, all those things affect how the gut moves, and gut motility is really related to all of that, and neurotransmitters really as they're produced by the body.
Yeah, completely. And I think I'm about 6 weeks postpartum now. And you're how many weeks postpartum?
9 weeks.
9 weeks. Yeah.
Not too much further than you.
Yeah, it's crazy. I mean, having a baby during this time. And so it's just a very, very wild time to have a child. A lot more stress, of course.
Yes.
But thank God for telemedicine. Thank God that we have some of these virtual tools to be able to connect with our doctors and something like this where we can connect to the patients and give them good information.
Absolutely.
And so let's get into it. I mean, because, I was in my second trimester, and in late 2019, in my second trimester, and I didn't poop for like 5 days. And I was like, what is this? No one told me that I was going to be so constipated. And I was just really shocked. And then I start texting my friends, many of whom are physicians, and they're like, oh yeah, like you're going to be really constipated. I was like, everyone talks about nausea, right? They talk a lot about nausea, and they don't really talk about poop.
Yeah.
And it made me miserable.
Oh, for sure. And the minute you tell one other person, 20 other people will chime in. And you're like, wait a minute, why didn't you tell me before? Because everyone's embarrassed and everyone thinks they're the only ones experiencing it. Ladies, let me tell you, we're all going through it. And it's very, very, very common. So please don't think you're alone in constipation. And pooping is no, matter to be shy of. So Constipation is one of those things that's related to that hormone progesterone. So obviously we need progesterone to keep our babies growing, but because there's such a high amount of it, it actually slows down how the gut moves. So basically things become more static. They stay there for a long time. That's why you have a lot more nausea. But also because you're having things moving upwards, things are also not moving downwards. So
Right.
that leads to having constipation. The other thing is you have a reduction of other hormones like motilin. That's what keeps your bowels moving. And when that's reduced, you're having a lot more constipation. Also, you're having a lot more volume in your body in itself.
Right.
So, that water is getting absorbed and your poop sometimes can dry out. So if you've got dry poop, it's not moving.
It's not going to move. And when should a pregnant woman sort of expect to see this creep up and like during her pregnancy? Is it second trimester or earlier?
So it can be anywhere. Really, it can start as early as the first trimester and continue all the way through. But a lot of it is also how you start treating yourself as soon as you figure out that you're becoming constipated. If you have undergone for infertility treatments, had IVF, so I did the progesterone shot. So if you're getting
Okay.
exogenous or outside progesterone, then you're introducing that extra hormone ahead of time, in addition to having the one that your body is making. So that'll contribute even further to making you more constipated. So if you know you're going to be predisposed to having a lot more, hormonal, running through your system, then, you can preemptively say, okay, I'm going to be dealing with more of this. Let me kind of get ahead of it before it gets me.
Yeah, no, that's great advice. And any other sort of factors to watch out with constipation, like, I mean, hemorrhoids or anything like that?
Well, yeah. So one of the things, you have to be, really cognizant of the supplements. So we're very good about taking those prenatals. You're like, okay, I'm trying to conceive. I'm going to get on prenatals. I'm going
Yeah.
to be on top of it. I'm going to make sure I take my iron. I eat my spinach. But you don't realize that sometimes those wonderful supplements and those vitamins are actually contributing to your constipation. So a lot of calcium from that Tums you're taking to get rid of that heartburn, or the iron supplementation that you might be taking, actually also, can cause constipation. So, make sure that if you're taking it, you're also taking a little supplement to help you go, which can be Miralax. You can take a probiotic, and you're making sure you're getting enough exercise and water too.
Yeah, I think that really helped me personally was when I really upped my water intake, which obviously is good in general, and especially postpartum, if you're breastfeeding, more
Yes.
water helps a lot. But yeah, I think for me personally, increasing the water intake, Colace didn't really do much for me. Miralax definitely helped me. Overdid it the first time. It was like, at first I couldn't go. And then I was like, how do I get this to stop? It's like, oh my
That's basically like a colonoscopy prep. You realize
yeah,
that, right? You're like
like,
completely cleaned out. Just get it now. Your gastroenterologist will thank you. They'll be like, wow, thank you for cleaning yourself out so well.
yeah, I was like, I know. My husband's like, I think you took too much of the Miralax. I was like, I think so too. I was like, out of my way. I need to get
Too funny. Oh
need
my
to get to the
goodness.
bathroom. Uh, yeah. So how long can women use these sort of over-the-counter remedies?
So, the good thing with Colace, Senecot, and even Miralax, which is polyethylene glycol, they're actually safe to use throughout pregnancy and even after. It doesn't really cause large electrolyte or vitamin or mineral imbalances, which is why it's so safe. So you can actually use it as you need it.
Okay.
However, if you keep seeing that you're having to take more and more and more Miralax or more laxatives, way past after you've given birth, there may be another cause for why you might still be constipated, and you might have to have that evaluated by a gastroenterologist.
Okay. And so in terms of postpartum, any other recommendations besides, the standard that you mentioned?
Yeah, so obviously making sure that if you had a third or fourth degree laceration, which means that you have a tear that goes from the vagina almost down to the rectum and includes the musculature there, that you speak to not only your OB but possibly a gastroenterologist, because those muscles, if they've gotten damaged, no longer coordinate like they used to before you had a baby. And so if they're not coordinating properly, that means they can either be too loose, not have enough pressure to push out the poop, or maybe even, subconsciously staying closed. And so they're not kind of relaxing on their own. And so what can happen with that is that you can develop something called pelvic floor dyssynergia. And
Okay.
pelvic floor dyssynergia just means that the muscles are not coordinating properly, and that's why you're straining against closed up muscles, and you're kind of just forcing yourself to poop, and you're not really having a solid, bowel movement. And so you should speak to a gastroenterologist about that.
And sort of, do you think this is something that could be addressed through telehealth or virtual health? And at what point does it change from a virtual visit to, okay, you need to come in now?
So, if you can do some things like squatty potty, which you can learn from telehealth. That opens something called a pelvic sling, and that increases the amount of room that you leave within your pelvic floor to kind of allow naturally for the poop to come out. If you're doing that, you're lifting your legs up closer to your chest when you're sitting and having a bowel movement, and all those things are not helping, then it's probably time for you to come in to see a gastroenterologist. And what that would entail is for you to get something called an anorectal manometry. Now, it's just a simple test where you're lying down and you're squeezing around a probe, and they actually measure how strong your muscles are, and are they strong enough to be pushing out the poop.
Oh, wow.
Sometimes when you've gotten a lot of trauma after you've pushed out a baby, those muscles have gotten really weak. And so it's okay. This is natural. But if you get a formal diagnosis, then your doctor can actually prescribe for you to go do pelvic floor therapy.
I was just going to ask you, I was like, can you work those muscles out?
Yes, and it's a great thing once a week. It's almost like, cathartic to go visit your pelvic floor therapist. You get to talk to them about everything that's going on in your life for an hour, and also get pelvic floor physical therapy done. It's an 8 to 12 week course, and
And
it's
it's covered by
fantastic.
insurance.
And it's covered by insurance, and it's fantastic because, you're retraining those muscles that you had forgotten that you were using, and you can kind of get them to go back to how they were normally, especially if you're going to have another child. You want to be able to kind of bring them back so you're not, peeing on yourself and pooping
Right.
on yourself, and kind of retraining yourself to kind of have normalcy again in your life.
Yeah, that makes a lot of sense. And talk to me also about hemorrhoids, because that's something that we like hear a lot about.
Yeah. So hemorrhoids, a lot of people are like, is it a piece of poop? Is it my actual rectum that's hanging out? Hemorrhoids are actually swollen rectal veins. Okay.
Okay.
So what happens is that they get swollen with blood, and with pressure, they get pushed out. So during actual vaginal birth, when you're pushing out that baby, veins that are kind of already gotten looser will come out. And oftentimes they don't go back in, they don't
Oh, wow.
prolapse. So they can stay out there. What can happen is if they come from the inside of the rectum, they're called internal hemorrhoids. And usually those are not painful because they don't have actual nerve endings within them. But
Okay.
if it's external, which means it's a little bit further out, they can be painful, itchy, and if they bleed, they can be very uncomfortable. And you're like, oh my God, what's happening? Is this a period? Am I losing blood from my rectum? What's happening? So it can be kind of scary if you don't know. And so with hemorrhoids, first you can do the conservative things. You can do something called a sitz bath. A sitz bath is basically where you get Epsom salts. You can put them in your bathtub, make
Mm-hmm.
a warm bath, and kind of just sit there and soak in your bottom. And
Okay.
that allows for it to kind of relax the area and kind of help the tissue kind of be less inflamed.
Okay.
You can also make sure that you prevent worsening of your hemorrhoids, again, with the fiber, the water, but also making sure that you are not straining too much, because the more you strain and the longer you sit there on the toilet, the more they're going to pop out. And I know sometimes you want to break from your kids. So you're sitting on the toilet, you're like, I need 15 minutes away. I'm going to look at Instagram and Facebook and feel like a normal person. But in that time, you realize 15 minutes turn into 30 minutes, which turn to 45 minutes. And then you've just been sitting there without pooping the whole time. And your hemorrhoid has now had a long time to kind of prolapse back out.
Oh, wow. Okay. So the main things really are, if anything is really going on too long and you've tried these conservative measures, it's time to talk to a GI doctor, or
Correct.
at least your internal medicine physician,
Correct.
wherever kind of access you have to those kind of
Yes,
physicians.
absolutely. Absolutely.
And postpartum, any other recommendations for how long we can use some of these methods, and by when should we expect normalcy of our GI system?
It's, again, very hormone dependent. So even just shortly postpartum, you still have that progesterone in you. It's, even though it's a much lower level because you've given birth, you still have that. Same thing if you're on medications because you've had a traumatic C-section or whatever, and you had to be on opioid medications, that will also slow down your bowels.
Right.
If you're still on calcium because your heartburn really hasn't gone away, or you're taking other, you're still continuing your prenatals during that time, that can also really affect it. So sometimes it may take a few months. I would say if by 6 months you haven't gotten back to your quote normalcy, then there might be some other underlying issue that needs to be addressed.
Yeah, I totally remember being told by a few people that to consider postpartum, to instead of continuing to take my prenatal, to consider a prenatal that doesn't have those sort of constipating factors like the iron
Yes,
and other elements that could, make constipation worse.
absolutely.
It's funny because I was on Dilaudid after my C-section because for pain control, and then I
Correct.
stopped it pretty quickly. And everyone's like, oh, did you stop it because you're afraid it's going to get into the breast milk? I'm like, no, because I want to poop. I was like, that's
Yes.
why
Oh
I
my
stopped
God.
it.
Yeah, because you're
It's like,
so backed up. You're like, okay, I'm pain free, but now I literally feel so
yeah.
full because I'm full of
Yeah.
everything
Because I'm
else.
full of
And
shit.
yeah, correct. And so you're like, okay, I need for, things to start flowing out again. So yeah, just be cognizant of that.
And yeah, and also I think we also both talked about our C-sections before, but I was afraid of straining so hard that I was going to pop a stitch. I was like, oh my God, my C-section like scar is going to open back up again.
Yeah, laceration, vaginal, perineal lacerations, those feel like things are just going to fall out and your rectum's going to fall out and whatever else. It's not, but it can feel like that when you're straining. So take it easy. Make sure you take stool softeners, and
Yeah.
kind of ease yourself into it. You don't have to force out, a big Bristol stool 4, which just looks like a Babe Ruth bar. You don't need to push out a Babe Ruth bar on the first day. It can be a little bit softer, and you can work your way
Never
up to the
eating
Babe
those
Ruth bar.
again, by the way.
In practice, I ask them, I'm like, okay, describe your poop. Is it look like a milk dud? Does it look like a Babe Ruth bar? Does it look like chocolate milk? And people are like, oh my God, I'm never going to have those. I'm like, yeah, but now you have a great visual. And
Yeah.
so if people can describe it like food, they can describe it well. So yeah, Babe Ruth is actually the standard, the gold standard for what you want your poop to look like. But postpartum, you don't have to really push out a Babe Ruth just yet.
Okay, good. Good to know. Good to know. Well, this has been a very enlightening discussion. On one of my favorite subjects, and obviously your top favorite subject.
Yeah,
As a
definitely.
GI specialist. To learn more about GI problems and GI disorders, where can people that are watching find you online?
Well, you can definitely go to my Instagram page, and that can be found at Dr. spelled Dr. Gut _ motility, which is spelled MOTILITY. So Dr. Gut _ motility.
Okay, awesome. And we'll also post that as well so that people can find you. And
Fantastic.
thank you so much for spending time with us. And I love talking to you about this. I hope we have more discussions about interesting poop subjects because I don't think it's talked about enough. It really isn't.
I completely agree. And I cannot wait to talk to you more about all things gut related.
All right. Awesome. Thank you so much.
Take
Take
care.
care. Bye.